Okay, today I'm going to talk about the optics of photoreceptor and the Stiles-Crawford effect. So let's move forward. So basically, optics of retina, there are a few things I want to emphasize. Retina contains the seat of photopigments and photolabel not only absorbs the energy from the photons but also alter the structure and transfer the energy, isn't it? So light converted to electrical signals. So basically, photons and photopigments and the vision to brain, isn't photopigments and posterior side light has to pass through the rest of the retinal tissues. Because what I mean to say is, let me show you what I mean to say. Okay, there's a lot of things we have to cover. Then I'll let me say this first. This is a photoreceptor, isn't it? The light have to pass all the retinal structure and then it will absorb by the photoreceptor. That's what I want to tell in this point. Okay, in optics of the retina, retinal image is real and inverted. We always know that real and inverted is why, because real and inverted can be projected on the screen. The sharp retinal image should be there in height of the image, and this is the formula. We can definitely think about it. Let me not going there. In optics of the retina, blur circle, as I have already told you, the retina works in the blur circle. As the blur circle ratio of the blur circle, see, blur circle is each object point forms the diffraction pattern in the retina, and we will definitely going to talk this about when the next video is in video on visual acuity definitely. So an object, a combination of blur circle from blur image on the retina, isn't it? Combination of blur circle. The recognition of blur image depending upon the blur ratio. And what is the blur ratio? That's the important point. Blur ratio is blur circle diameter divided by blur basic height of the retinal image. That's why blur circle diameter is high as 0.5 is recognition. So basically, retina works on the blur circle as a point object makes the image of blur circle, not exactly point image. So that blur circle, as the size of the blur circle reduces, the more resolution we can gain. Isn't that's how pinhole works? It's the same principle we have discussed. Now come to the Stiles-Crawford effect. Okay, the effect regarding light entering the eye, directional sensitivity phobia, was discovered in 1993 by W. Stalin and B. Crawford. That's why it's called Stiles and Crawford effect. Okay, the effect has carried out their name. Let me tell you one second. It's not a rule. It's not a law. It's the effect. Okay, so it has an effect of light entering the eye through the center of the pupil. So several times pupil is several times more effective than one coming through the pupil periphery. See, it's about light entering. It's about light entering from center compared to periphery, and center has several times more effective than periphery. Okay, it is Stiles-Crawford effect is not the principle of pinhole. Just remember that many of the college I have seen in, especially in India, they teach their student that Stiles-Crawford effect is a principle of pinhole. That's not the case, because yes, we use the help of pinhole, but not Stiles-Crawford effect is not a principle of pinhole. Principle pinhole works to reduce the blur circle. It works directly. A Stiles-Crawford effect is visual perception thing. Okay, I'll tell you why it uh, Stiles-Crawford effect works. Because why centered pupil center light has more effect than the peripheral light from the pupil and through the optics. Okay, I'll tell you the effect is more pronounced light adapted cone. Okay, not in a dark adapted cone. It's a light adapted cone. Effect is more pronounced at the foveal portion of the fundus. Okay, effect is more pronounced in the foveal portion of fundus. Then what is Stiles-Crawford effect? Light entering from the center of the pupil has several times more profound effect than the light coming from periphery of the pupil. Virtually absent in the rod line surface on the retina. So Stiles-Crawford effect is a function of cone, not a function of rod. Okay, are you getting the concept? Okay. So Stiles-Crawford effect, rays of light passing through the center of the pupil are less oblique to the cone and stimulated them more strongly than through the why they are more stronger, because they are less oblique to the cone. So cone, basically cone has a structure, isn't it? This is cone and this conical section and all these things, isn't it? The light coming from center of the pupil has less obliquity to the cone. It's less like this. It's not like this. It's directly like this, isn't it? So, a displaced Stiles-Crawford effect associated with the eccentric people. If what happen if people is centric, people is not centered. Psychophysical studies of receptor orientation and direction sensitivity in subject whose right pupil is displaced nearly 3 mm nasally as a result of injury sustained 25 years ago. The Stiles-Crawford effect was measured for fovea cone and for the peripheral cone. Greatest sensitivity was found in all cases at the point close to the center of the natural pupil, indicating that the receptors of the eye are so indicating that the receptors of the eye are towards the center of the pupil. Okay, and the Stiles-Crawford factors that affect the Stiles-Crawford effect is, see, wavelength of the light incident, because decrease when the light from shorter wavelength, short to long wavelength, okay, it's maximum at 550 because cone has receptor sensitivity maximum at 550, isn't it? When going from short to too long, if a wavelength goes from 550 to max, even higher, then Stiles-Crawford effect decreases. Okay, ocular media clarity, the more the ocular media is hazy, Stiles-Crawford effect get decreases. The self screening for the respective visual pigments, shorter wavelength sensitivity cones show the larger directional sensitivity than longer cone, and the maximum direction sensitivity we know it 555, isn't it? So Enoch et al. 1980, the directional sensitivity of the fovea of an eye is significantly reduced if it is occluded by black patch for several days, isn't it? It took 3 to 6 days to reach maximum effect, and similar period is recovered. So, if you cover one eye with a black patch, then directional sensitivity reduces. So, light rays that strike cone perpendicular to their surface, that is pinhole centered, are perceived as brighter than those do not strike perpendicular to the surface. Okay, pinhole decentered. So, in this picture, pinhole is used to decenter the light and to center the light, and there is nothing to do with principle of pinhole. Okay, just remember this point. This effect, which is strongly manifested by cones, is refracted to as Stiles-Crawford effect of first kind. Okay? So, see in this picture, Stiles-Crawford effect, first kind. A centered pinhole top causes the light to strike in the fovea cone perpendicular to the surface, whereas decentered pinhole causes the strike light obliquely. So, this is the great picture. If exam you must understand this picture. Okay, light ray entering point 0 is centered and which has highest Stiles-Crawford effect because it perceived as brighter. As you move from center to temporal or nasally, the brightness sensation decreases. Okay, this is very good picture. Okay, just remember this point. So under normal circumstances, cone point towards the center of the pupil, maximizing their effectiveness. What are the consequences of chronically decentered pupil? Illustrated in a figure 31.2. Okay, in this figure. Okay, do the cones to point to the position center and towards the location of the decentered pupil. The Stiles-Crawford effect manifests and the eyes displace suggested that the cone point towards the location of the decentered pupil. So first, if eye is normal, the cone is directed towards the pupil center. If pupil center is decentered, then cone is slightly tilted towards the new pupil center. That's what Stiles-Crawford effect do. Okay. So Stiles-Crawford effect second kind refers to change in hue and the saturation on the monochromatic light. The point entry. See, we don't talk about second Stiles-Crawford effect second because see, if you consider color as a point of view of uh, visual perception, color is described in three terms, isn't it? One is brightness, second hue, and third saturation. So Stiles-Crawford second contains these two, hue and saturation. But Stiles-Crawford 1 contains brightness. So Stiles-Crawford second has little less evidence, and Stiles-Crawford first has good evidence. So that's why we don't Stiles-Crawford second for just knowing things you can learn it. Stiles-Crawford second is referred to change in hue and saturation of monochromatic light as the entry, as the point of entry to the pupil. It changed. Basically, in color, two components contains Stiles-Crawford second, but brightness contains Stiles-Crawford first. Okay, so basically, this is the principle, isn't it? When light passes from cornea to lens and vitreous, then it should pass all the way optical neural fibers, ganglion cells, bipolar cells, and then finally it reaches the rod and cone. Okay, it's just opposite, isn't it? So we know that rod and cone has a peak at phobia. Yes, and this is the picture by Santiago Ramon y Cajal. I think he's the father of neuroscience, modern. So this is fovea, where the center, the vascular structures, and this is the rhodopsin regeneration cycle. I think you know vitamin E cycle. Now this is the slide I want to discuss with you. Why Stiles-Crawford effect work and how cone and rod absorbs the light? Because see, principle of optical fiber of the light guidance. Because see, when light comes here in the rod and cone, so cone has this disc here in the tip, but it has to pass this pathway first. So in this pathway, light passes in the total internal reflection fashion, isn't it? What I want to tell you, this light must pass this whole pathway to get into the disc, and disc absorbs the light, isn't it? So to pass there, light must pass so centrally that they pass this phase with total internal reflection. This is what the concept of Stiles-Crawford effect. This is was the optics of rod and cone. So transfer the light through the cone and rod by multiple total internal reflection. So if light goes this way, for example, this way, then it is there is no going there will be no total internal reflection. So light passes away, and that's why they cannot absorb by disk or rhodopsin. So that's why it's central important to pass straight, and when it pass straight from the pupil, there is more chance of total internal reflection and there is more chance of absorption. That's why we always go from, if light passes from the center of the pupil, there is a high chance of that absorption of light, and it causes the brightness highest. Okay, that's why this Stiles-Crawford one effect. So that's why all the photoreceptors, especially cone, orient themselves towards the secondary nodal point of the eye. Why? Because from secondary nodal point, light hit to the photoreceptors, especially cone, because Stiles-Crawford one is a photopic functions. Okay, so this is the picture I have already shown you. Zero direction, the maximum Stiles-Crawford effect. So I have taken this as a reference by Professor Dr. Josh Asimelis, and obviously you can learn a visual perception book by Stephen H. Schwartz, and that's great two books. Okay, Bistan, cheers.